Good morning, and welcome to this multi-part series, Improving the Continuum of Care. I'm Dr. Larry Patterson with Eye Centers of Tennessee, and with me today are Doctors Eric Schneider and Rishi Singh. Over the past decade, you, like a lot of us, we've faced increasing challenges. The electronic health record requirements, staffing shortages, especially in the last 2-3 years. We've got declining reimbursements, quality reporting demands, prior auth. It just goes on. And understanding that these challenges can be difficult for a bunch of us, and it often requires additional time and resources. We just want to kind of understand how you're dealing with, how you're improving the continuum of care for your patients. And so what I want to start with talking about practice efficiency and its impact on the patient experience, your experience, outcomes. So specifically, let's talk about the practice. And Rishi, I'll start with you. What efficiencies have you created in your practice that support patient care?
Yeah, Larry, this comes very topical because we're in the process of building a new office, and at the same time we had the pandemic, which created incredible stress on organization. We moved imaging closer to the patient. We used to have a dedicated imaging core kind of location where we used to send patients. And now when we think of offices, we think of placing the imaging closer to the patient rather than farther away to reduce traffic, reduce movement, reduce technician time with the patient, reduce chair time. We're now putting together an office where I'm in my new job in Florida, and it's not a big office, but what we've decided to do is divide up our imaging into 3 different areas, in fact, in that little office, because of the fact that we know that we need a specific area. Each lane basically has its own dedicated imaging, because imaging has become so embedded in our retina practices. We can't make decisions at this given stage without those imaging pieces. And so that has really become a big transition for us during the pandemic, and especially now in the thought process for the office of the future, that imaging has really been part of that overall sort of planning and design of discussion.
Eric?
I think current retina practice really is all about sort of volume and throughput, right? I think both from a business and a patient perspective. I think the business is certainly driven by seeing lots of patients. I think our patients, their ideal scenario is to get great quality care, but they don't spend all day in our office, waiting to see the doctor. And so I think, like a lot of, growing enterprises these days, we've really invested a lot in IT. And so that involves a lot of different technologies, sort of online check-in. We've certainly really, beefed up our, networks, both from a security and speed standpoint. And then, I think we have leveraged, I think, as Rishi was talking about with imaging, we unfortunately don't have, we have several older offices, but it would be great to have that sort of individual, imaging, set up for each lane. But what we've done, is sort of try and mirror our workflow with our physical space, and then, sort of had the opportunity to purchase kind of the most updated devices. So, devices that are able to acquire images very quickly, which I think improves throughput and also sort of image quality. So things like the Cirrus and the Claris 700. And then the other thing, going back to the sort of networking capabilities, we really have a robust sort of intra-office network where we can really push images around very rapidly. So that allows for us to, have, dedicated image review workstations in each lane. And that, I think it enhances both the doctor experience, just from the standpoint of being able to sort of better, manipulate and review images, and also allows us to educate patients by having those images available in the office. And software like Retina Workplace and ZEISS Form have allowed us to really maximize that. I think they're sort of robust image software review, and I think that I said it's really sped up the process whereby we can educate patients and they feel like they've achieved what they need to learn from us, and also we get the imaging data we need while in the lane.
I'm gonna get to the doctors here in a second, but put yourself in your patient's shoes. How do you think your patients, when they come to your practice, how do you think they view this whole experience, and what have you done to make their experience more positive?
So I think that one of the things that we've been able to do is leverage virtual visits for this. So, if we have a patient, for example, for dry macular degeneration who we're monitoring, every 6 months, like we all do, or we're looking at a patient, for example, who has diabetic retinopathy and they're coming in for a screening, there's no reason a lot of that stuff cannot be done with visual acuity, tonometry, just a simple fundus photograph, maybe an OCT, and the patient goes home and doesn't wait for us, and we can call them and have a great experience on the phone with them and talk to them about their results and give them the information they wanted as a way of extending our office times. Too many of these patients, as they are, we all are, we're working age adults, and so they don't have the time to necessarily come in at the 9 to 5 hour time frame. So we've actually looked at doing evening hours where we just have a technician there and do virtual visits the following day with the patient. And that's been new from the pandemic. I mean, who would think that we could ever do virtual visits with ophthalmology? But the answer is that for some conditions, it does help. And I think we're on the precipice of a lot of things, from artificial intelligence to other activities that are helping us do this. The other big change has been with our chair time. And we used to do a lot with chair time in patients and imaging, to then take the image and then export the image and then export these PDFs essentially. And we used to print them back in the day and use up toner and everything else. And things like Eric mentioned about Retina Workplace, to me, have been so foundational in making sure that we can get the patient in and out with that single scan. The single scan, the cube scan, is all we need, because we can do all the post-segmentation afterward. And tools like Glaucoma Workplace, Retina Workplace, Cataract Workplace can help us better manage these patients from a data perspective. So we make more efficient, less error in our system to help these patients over time.
Eric?
Yeah. I think patients have really come to view, medical care like any other service industry now, where, your car repair shop or your restaurant or your legal office or whatever. And so, I think that, we have tried to adapt to that sort of standing in the community now. And we want to, put our best foot forward. So, I think we try to regularly update, sort of our facilities. I think we spend a lot of time, working with staff to make sure that, they're, professional and efficient and pleasant, right? And there are, ways to, enhance those attributes in our staff. And obviously, I think, ultimately the patients, in addition to, wanting to be in and out, still want to have, a comprehensive experience with the physician, so that, even if the chair time, as Rishi alluded to, is short, with the physician, they want to be able to get as much out of that short period of time as they can. And I think, again, that's where, the imaging and education we can provide to patients through imaging. It's much easier to, explain to a patient with a new diagnosis what's going on when they have, sort of visible evidence of the disease that we're discussing. They say that a picture's worth 1,000 words. And so I think, Rishi hit a lot on the head, is that, we're really reliant on, both the imaging devices and our ability to display the images that were created by those devices, in the lane, and have them, available for patients to review, along with the doctor. Additional things, we don't do virtual visits, but we have tried to expand hours. We offer a Saturday AM clinic. Doctors are available, 24 hours on an on-call basis. And so I think those sorts of things also, meld with this idea that we're a concierge, a service industry, right? I think, we want to provide high quality care, but also, want the patient to feel like the experience was, something that, they want to go back and tell their friends and neighbors about.
So what about, just from now I'm getting back to me, how does this improve your experience, and kind of combined with that, what are you doing with your staff to try to make this work better for all of us?
Yeah, I think this to them has become a practice efficiency. So they would spend a lot of their times with the things we just talked about: printing, moving, sitting with the patient for a long period, being exposed. We talk about the COVID pandemic and timed FaceTime for exposure, and this has reduced all that. The benefits of that are really quite great, I think, overall, and that's what we've been able to see with our individuals and our employees. And vis-a-vis, I think this has also allowed for more of them to be involved in imaging. Imaging used to be a very technical field, right? When we first started, probably all of us in this practice, we had photographers going to specific schools or areas and all these, sort of training periods. And I think that has become a lot simpler. Things that are wide field imaging and things that are related to OCTA don't require significant amount of technical experience to complete them. They do on the back end for the interpretation side, which keeps us working hard, but certainly not for them when they are taking the images and acquiring the images. So the good news is that the acquisition has become far easier, and I think that the better news is that that has also improved the workflow and efficiency and overall engagement of people that we work with. And again, of allowing for flexible hours as we have has allowed people to say, I really want to be home in the morning to put my kids on the bus, but I don't want to be there in the evening to take them to bed. So we have them picking and choosing what they like to do, which is great. I think it gives a lot of workforce flexibility, and that's what I think keeps people engaged into the job ultimately.
That's fantastic. Eric?
Yeah, I think from a provider or sort of selfish standpoint, I think what I'm looking for is to spend less time on the sort of grunt work of patient care. So the charting, the downtime to pull up images, prepping rooms for exams and and treatments. And so what we really want to do, as a provider, is spend our time, where we think we get the most benefit, and that's, I think, interacting with patients, using our clinical skills to make diagnoses and devise treatments, and I'll also stay on time, right? I think that's the other thing is, as a provider, falling behind is never pleasant, and it adds stress to your day. And so I think all these things we sort of discussed with efficiency tie into enhancing the provider experience, right? My sort of daily happiness is definitely impacted by this, and some of that is I think you alluded to, Larry, is the staff stepping up and taking on a lot of these roles. In our practice, we have a very codified sort of specific instructions for each doctor. Unfortunately, everyone likes to do things just their own way, but so there are elaborate sort of handbooks explaining how each doctor does their injections or pneumatics or whatever. We do have a pretty robust, staff training protocol with sort of graded responsibility and various training, periods to, move up to the next, level of staff, responsibility. We have sort of regular meetings, with the staff and, check-in and scribes about, new medications, new treatments, new things that are coming down the line. We track errors, by staff and work on remediation in that regard. So a lot of that, goes into, enhancing provider experience, because they're taking a lot of that burden off the provider. I think also, as Rishi mentioned, we cross-train our staff. And so, we need a lot less, imaging specialists now because, the devices are very very quick. So we have great throughput, but also, we can grab a check-in, or tech or a scribe and have them, do OCTs or even, photographs now on the Claris 700s, relatively easy tabletop device. And so, I think that has allowed us to keep things rolling and avoid bottlenecks. And then obviously we all train the techs and the scribes on how to use Forum and be able to manipulate and pull things up. So I'm not spending a lot of time with my back to the patient as I'm moving from eye to eye or pulling up a different a cube or trying to align something in Forum. And so I think that has again also enhanced my experience because I'm just focused on the patient.
You bring up something really good, and I was just going to make a personal comment because we hear so much in the medical literature today about physician burnout. And when I think about 5-6 years ago, we had an EHR system that I hated. We didn't have Forum. I'm not retina, but Eric knows me pretty well. He's just down the road from us. We have a very high volume practice with a lot of retina, glaucoma, everything. And now we have an EHR we actually enjoy. We have Forum, which is great. We don't have the papers. And Really, none of the guys in our practice are experiencing burnout. We actually enjoy what we're doing. We come to work and we don't see burnout. We're enjoying what we're doing. If we pull all this together and we combine this greater practice efficiency with we'll call it an enhanced patient and provider experience, what will to pull this all together, what will all this have on outcomes for your practice, Rishi?
Yeah, I think it leads to our big organizational focus is error and leading to zero error in every patient. And, I think all of us have been there, busy days. You look at the wrong eye, you look at the wrong IOL calc, that happens to us. And I think that the point is that we cannot accept errors in our system. And Forum has been the way, and we've had it for 12 years in Cleveland. And now I'm about to get it in Florida. It has been a way that we've been able to keep error at the lowest rate possible. All of us are human beings. We all make mistakes. We all realize the fallacies of our ability to take care of patients in the morning versus the late evening, right? There's differences there. And one of the things is having guidance systems like this to help us with those processes in place. For me, that's been a huge benefit. Being able to show patients, especially as well, their longitudinal care has been another benefit of having this. Having 12 years of data sometimes and showing them the progression over 12 years can be quite an educational experience for them to understand what they can do. So I think for both the practice and the patients, there have been innumerable benefits. And again, we really focus on the quality patient experience and the care we're providing. And this has allowed us to provide exponentially better care and exponentially better opportunities for our patients overall.
Eric?
Yeah, I mean, I think Rishi definitely hit it on the head. I mean, obviously we're focused on providing high quality care, which I think equates to low error care. I also think that a lot of these enhancements or efficiencies, I hope and I at least feel personally that it improves the overall happiness of everyone involved in this sort of clinical interaction, both the provider, the staff, and the patients, right? Because they're getting what they think is sort of best in class care, but it's done efficiently. They're not spending all day in clinic. And like I said, they feel like the focus of the visit is their interaction with the doctor, where we're sort of doing that sort of information transfer. I think software like Retina Workplace and Forum really enhance our ability to quickly and efficiently transfer a lot of information to the patient and really get them up to speed on what's going on with their eye. And it's scary when they come in with a new diagnosis. They're not really sure what's going on, and then we start talking about these scary treatments. We're going to stick a needle in someone's eye. The last thing they want to do is be unclear of what's going on and why this is all happening. And so I think you really reduce that stress on the patient when they are very clear on the situation and are well educated on the specifics of the condition and why these treatments, which sound scary, are necessary. And so I think the outcome that we can hope to achieve is that these patients leave the office educated and happy that they had a positive experience, and then it's going to keep them coming back. Because that's I think one of the big things that we struggle with modern retina care, and particularly intravitreal therapy, is that these are treatments that have to be done over and over and over again. And so if you have a bad experience with a patient, or they feel like you didn't take the time to explain stuff to them, they're not going to come back, and that's going to result in bad clinical outcomes. They're going to come back, the typical diabetic who you give one injection, they come back 6 months later with a terrible tractional detachment. And so I think again, by making this experience positive for people, I think we're going to enhance their clinical outcomes as well.
We've been mentioning some of the ZEISS products. How does ZEISS support you in your practice, and what value have you seen using some of this, the workplace and Forum and partnering with ZEISS as a company?
Yeah, we've had a great experience. We've actually worked well with them with regards to their ability to service our devices in a rapid fashion. The last thing you want in your practice is a day where things go by and the device breaks down, or there's some issue there with the device not operating properly. So they have been really fantastic about coming in, servicing the device as soon as possible with any sort of activity or issue that occurs. Also, I would say to you that the software updates have been amazingly improved. We've seen great improvements in what we've been able to do with those software updates over time, and they've really made a huge difference with regards to what we've been able to achieve.
Eric?
Yeah, I mean, I think we've been sort of a ZEISS practice, since I started, 9 years ago, and we've seen the iterations of the next generation devices, and I think they're always a big leap forward. So we've always appreciated, when they come up with something new, it's not just a tweak, it's sort of a leap forward, and I think we've appreciated that because it enhances our practice. I mean, the number of images we get, I think today, per patient relative to when I started 9 years ago is infinitely greater. I think because they're just more valuable and they're easy and quick to acquire. I think the other thing is I think it's an innovative company. They've worked hard with us. We have a very unique, sort of imaging and IT setup. We have one gigantic, imaging database or server that has 30 terabytes of images on it, but we were able to access all those at all of our separate locations. That's a lot of data to push around, and so they've worked with us to find a setup that's sort of, conducive to how we want to practice. We want to have access to all those images from 9 years ago, sort of at the click of a mouse, right? And so, that's not something that's easily achieved, and so they're willing to, provide us, sort of ZEISS resources to set up that situation where we can still, have this huge database, but have it functional and easily pull up images in the lane. And so I think we really appreciated that. It's not just here's the software, figure it out. They're willing to work with you and customize the solution to how you want to practice. And so I think that's been a really rewarding experience on our end.
Well, we want to wrap this up. I want to thank you, both of you, Eric Schneider and Rishi Singh, for taking this time to discuss and talk about this, how efficiency and supports like this can enhance patient care. And we look forward to talking to y'all again soon. Thank you again. We appreciate it.